Okay, so today we're going to be talking about rotator cuff tears and injuries. And really quick, this is when there's a tear of one or more tendons of the rotator cuff muscles. Now, for the most part, if you remember when we spoke about the rotator cuff, we said there was four muscles, and they were called the sit muscles: the subscapularis, the supraspinatus, the infraspinatus, and the teres minor make up the rotator cuff. If you also recall, when we were talking earlier, we were talking about AC joint separations, and we talked about the different grades of strains to the joints. And in this case, we said it also applies to sprains and strains. So if I have a rotator cuff injury, if it's not bad, I just do what we call RICE. It's rest, ice, compression, and elevation. Compression just being like you put the ice on there and press down on it. So that's the treatment for these most of the time. Every once in a while, this will require surgery. And so let's go ahead and go through this. So we already said it's when there's a tear of one or more tendons of the rotator cuff muscles. Rotator cuff injuries occur due to overuse, repetitive injuries. So who's most likely to do that in sports? They're baseball players, usually the pitchers, right? And tennis players, because they're constantly hitting the ball. They're coming over their head and hitting the ball, and they're coming around. So they're using the shoulders a lot. That'll create those injuries. It can also be due to trauma, heavy lifting. So let's say you go to lift something, and when you go to lift it, you end up tearing one of the rotator muscles, tendons. What are the symptoms? There's pain at rest. Normally, ligaments and tendons are going to give you pain at rest. And normally, and injuries to muscles are usually pain when you go to use the muscle. There's pain when you're laying on the shoulder. So pain at night, first of all, the reason you get pain at night is because most people have been using the shoulder during the day. There's pain when laying on the shoulder, so which is kind of obvious. If your shoulder hurts and you lay on it, that should hurt. Pain with lifting the arm out to the side. Remember, lifting the arm out to the side is called adduction. I'm sorry, abduction, abduction. And that's what basically a lot of the muscles in the rotator cuff do, is abduction. And so you're going to get pain when you try to lift out to the side. The reason you get it when you're lowering it down is because you're trying to control that. Those muscles are still trying to work to bring it down smoothly. And then you're going to get crepitus or cracking when moving the shoulder. Crepitus is a grinding sensation. And then crackling, I think everybody pretty much knows. You get that little popping sound as you move your shoulder. So let's go ahead and take a look at these. So if we take a look, just a reminder of what our rotator cuff muscle is. The humerus, again, is your arm muscle, right? Your biceps would be around in here. When you go to flex your arm, that would be this bone that's right here. Okay, you had your supraspinatus, which, if you remember correctly, came down and attached to the top of the shoulder. You had your infraspinatus, your teres minor, and your subscapularis. All this white here that you see on these are the tendons. So I've mentioned this before. Tendons attach muscle to bone. And there's a little bit of tendon right in there. Okay, so tendons attach muscle to bone. Okay, so you're going to get a tear in one or more of these tendons with a rotator cuff injury. And here, once again, is looking at, this is looking from the front now. So the other muscles, like your supraspinatus, would be back in here. This is looking from the front. So you'd have your subscapularis. And again, here's the tendon of this. And again, here's the muscle. Here's my tendon. So as you can see, it attaches muscle to bone. So let's take a look some more. And as you can see right here, now that actually looks like they have more of the muscle is torn, but you can see we got a tear that's in the rotator cuff here. And again, it can be anywhere. This would be the supraspinatus tendon that's being torn here. This would be my subscapularis. Most likely this is my subscapularis tendon that's right here. So, and again, the AC joints up here, I'm just pointing this out because we've covered it already. but you can see this is where my tear is right here. And it could be any one of these tendons that have to do with the rotator cuff. So if you look, this is a picture here, and you can see here's his shoulder. Now the shoulder is actually going back this way. So you can see that's going to be the infraspinatus muscle and podator teres minor. This is where the most damage is going to occur. Let me see if I can use a lighter color. Right here. I don't know how well you can see that. Because what's going to happen now when you pitch is you can see this is how far back that shoulder is. And now this is just going to be like winding up to get this ball out. And then if you look here, how we're coming across the front. Okay, and then you imagine doing that over and over, year after year after year, and you can see how you can start to get damage in that rotator cuff. Okay, if you look again, you can see the amount of stress that's just being put on the shoulder. Because again, as he comes around, this is just going to rotate that shoulder, and he's going to come across the body this way. So you're going to see there's a lot of strain put right on that shoulder. And that's why rotator cuff injuries are so common in pitchers. Okay, so let's look at orthopedic testing for the rotator cuff tear. The most common one is just the drop test. And what happens is the doctor raises the patient's arm above 90 degrees and then just lets it go. And if the person's rotator cuff is working okay, they'll be able to hold the arm out there. If there's a tear in it, they'll have weakness and they won't be able to hold the arm up, and it will jerkily come down to their side. And you can see in this case that it says the patient is asked to lower their arm to their side. You can just have the patient hold it out there, but you can also ask them to bring it down to their side. And if they can't do it in a smooth motion, then it's a positive test, and positive for a rotator cuff tear. Okay, and like it says there, just having pain does not mean the test is positive. Normally, you're going to have that jerky movement as you bring it down to your side. If you remember what we mean by this, other tests are to test the integrity of the sit muscles. This should actually be SIT. So if you think about the things that the sit muscles do, like if they do internal rotation or external rotation, what you do is you have the patient do those motions and you resist. So for example, the subscapularis does internal rotation. I could have the patient put their elbow by their side, put their hand out in front of them like they're going to shake my hand, and then I tell them to move their hand towards their stomach, and they just resist, and that will basically prevent internal rotation. If they have pain, it may tell me that there's a rotator cuff tear. If I do these other tests on other parts where I think they might have torn, I may be thinking they have a tear. From there, I would go and do an MRI to see if there's actually a tear of the rotator cuff. And then from there, I would determine whether to do surgery or some type of treatment. Okay, so let's take a look at doing this test. Okay, and so that's basically it for the rotator cuff.